Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the May 29th media availability. Thank you for being here.
Thank you.
Before we get started with questions, can you take a little time and tell us where we are with reopening?
I know it's been a crazy thing lately, the pace of this. And I know it's been a bit confusing for everybody, and a lot of the information that's come to us from the governor's office, for instance, we have not had much lead time on. And so we're sort of hearing and understanding a lot of it at the same time that the community is. So I think the best way to sort of frame this is that in response to requests from many counties across the state, I think the governor's office is gradually turning over more and more pieces of the framework to local control. And I think that that is a great approach because we will be able to tailor things. But I just want to emphasize to people that in spite of that, the governor opening those things to local control does not mean that the governor is endorsing that all of those things be open all at once. That is not the message. It simply allows for local conditions to help mark the path going forward. And it's very important for us to follow the sort of framework that we've been talking about here for a long time, which is that we look at our local data, we open, we allow enough time to be able to sort of keep monitoring the data and see what effect we're having, and then we move forward some more. It would be lovely for us to flip a switch and just be back to old times. That would be great, but it's not safe to do, and in this situation, not a practical move. So we need to pace ourselves a bit. We've sped up our pace compared to what we originally had planned at the outset of this pandemic, but we're monitoring very carefully. And so as people know, we began opening retail a couple of weeks ago. It's been now about 2 weeks, and we are allowing restaurants to open. And again, in accordance with the guidance provided for safety and with approval at the county level, so that people going to visit these entities know that they have submitted a thoughtful plan that the county has reviewed. And I think that is reassuring for both employees and for people in the community. And we'll continue that process as we move forward.
Excellent. Thank you so much. On Thursday, the Sonoma County Sheriff said he and his department will no longer enforce Sonoma County public health orders. How difficult do you think it will be for the health officer there to minimize risk of transmission if the public knows they will not face consequences for disobeying the orders?
Well, first off, I found that announcement disappointing. And I think in the best of all worlds, this really is a partnership between public health and law enforcement and multiple other entities within the community. I think that from the beginning, we have framed this as primarily education rather than enforcement, because we believe that most people, given good information about safety and about what is needed going forward, will use that information and do what's needed to protect their family members, their friends, other members of the community as well. And so I think that remains the case. But again, it's certainly not optimal going forward for Sonoma.
We have another question along those lines. Sonoma County Sheriff Mark Essick yesterday announced that he will no longer enforce his county shelter orders. With the increasing partisan divide over government health orders, do you feel that the Humboldt County Public Health Branch has the full backing of Sheriff Honsal?
Well, I've really appreciated Sheriff Honsal's support in this. We have met extensively over the last few months, and we continue to do so. I appreciate the perspective he brings to the table when we meet and sort of make plans going forward. And, frankly, I count on that continued support.
As the local number of positive cases continues to grow, and with the third local death reported, is there any consideration of pulling back on the reopening of businesses, or do you continue to believe it is a good idea to move toward phase 3 of reopening?
Well, first, I wanted to mention that, of course, we mourn the loss of any resident of our community. And again, it highlights the issue that COVID is a particularly problematic infection for people who are older and more fragile in general. That being said, looking at mortality in our county due to COVID is only one of the indicators that we look at for deciding on safety of moving forward. We look at multiple indicators, and I think that we are in a position to move forward. However, again, I want to emphasize that it's important we do so gradually rather than all at once, and that we're constantly monitoring data as we move forward.
Okay. Now that local restaurants are being cleared to resume dine-in service, do you personally plan to eat at any of them, and would you advise your own family members that doing so is safe?
I certainly miss dining out in Humboldt County restaurants, as do many people, I know. Personally, I'm 60, my husband is 70, and so we will likely be eating at home for the most part. But I do suspect that there will be occasions that we will go out and eat. I would just recommend to people that there is really very good guidance available for restaurants to operate under the time of COVID. And that again, those restaurants are using that guidance, they're submitting plans, it's being reviewed. And the reason for doing so is to really help ensure that people are safer going out and eating or doing other activities in our community. So I think that people can do that, but again, I would still encourage that people who are perhaps older or medically have underlying conditions that put them at risk strongly consider whether they're going out. And if they do, perhaps they want to do something like go at hours that are not as populated. Go to places that are structured for outdoor dining or that really have, sort of different capacity levels. So all of these entities should be prepared going forward. And so I hope people are able to enjoy going out a bit more than we have been able to.
On Thursday, another Humboldt COVID death was announced in connection to Alder Bay Senior Living Facility. Have you recommended a plan to Alder Bay for how residents in the facility who develop COVID-19 will be handled? For example, transferred to a single room, or implement use of transmission-based precautions, prioritized for testing, transferred to COVID unit if positive?
Sure. So we have worked extensively with Alder Bay, and over this time period, we have, again, worked on many of these issues. We have made sure that they have adequate PPE. We've helped to get new additional staffing on board, to have additional staff trained in a variety of things. We've done ongoing testing for that facility and are continuing to do so. Interestingly, in our area, and this is common across many areas of the state, most facilities are not structured to be able to have a separate wing, perhaps, or area to have a unit as described in this question. And so it's really a matter of looking at the landscape of what they have and how we can be safest within that. So also just of note, we're working intensively with the other assisted living facilities as well as our skilled nursing facilities, going on site, providing a lot of the same assistance so that people are prepared.
Excellent. Is it true there are various strains of the virus? I've heard rumor that there are 3 strains. Can you please explain?
There are multiple strains of this virus, and there's really no evidence that I've seen to date that any particular strain is more virulent or causes more significant disease than another strain. But it's very normal for virus strains to mutate and circulate in all of their varieties through a country or community even. Luckily, the testing that we have in our lab and in many of the large commercial labs, the RT-PCR testing, is designed actually to capture the common pieces of genetic material across those strains so that we're able to identify it in testing.
Excellent. Can you provide specific graphs showing what modeling looks like with the current amount of the county open? When is the current influx expected to peak, and what does that mean in terms of expected hospitalizations?
Well, it's an interesting question. I don't have a model for where we are right now. And again, I think most people are aware from previous conversations that it's very difficult for us to have a modeling that tells us that what opening retail does or opening a restaurant will do at this time, just because there are a whole lot of variables. What I can say is that over time we will sort of recreate our models and keep looking. At this time, mostly what we're doing is looking at trend lines, and our current epidemiology and looking at all of those trigger features that we've been talking about within our variants to monitor where we are in terms of safety. In terms of the question about peaks, what we're tending to see with COVID right now is a sort of this kind of pattern. We get clusters of cases, we see identify contacts, we quarantine and isolate, and then we gradually see a decrease until the next sort of cluster of cases emerges. And so none of these are in a sense a surge. It's not at that level. But I anticipate that we're going to see a lot of this potentially going forward. And our goal, of course, is that we sort of have these smaller peaks as we get these clusters without ever having tall peaks that we can't accommodate. And again, that's what we're going to be looking at when we monitor our data is, are we able to keep up with the case investigations? Are we able to isolate and quarantine quickly so that we can help to contain spread? Do we have hospital capacity? Do we have ICU bed capacity? Are we testing enough? And what's our increase or trend in positive cases? So all of those things are on the table, and we look at those things daily.
Excellent. Thank you so much.
You're welcome. Thank you.